Hello, Dr. David McFadden here from the Dental Implant Center in Dallas, Texas. Today's topic is patient advocacy. I came up with this idea about who is the patient's advocate in dentistry based on my experience with my father, who is in failing health from a medical standpoint. He's very fortunate that my sister is an RN and she's worked in many different parts of medicine, so she's become his medical advocate, and she's actually been able to prevent a good number of disasters with my dad's care because, as you all know, the medical industry, the doctors are overwhelmed by patients. They don't get to spend enough time with the patients. They don't get to review the charts. Different doctors and different specialists really don't even communicate anymore. So with our aging population, they all need a medical advocate, and my dad's really fortunate to have my sister. But it got me thinking about dentistry. When the average patient comes in for dental treatment who doesn't know anything about dentistry, how do you know if you're getting the right recommendations? And how do you know that you're not being overtreated? It's a real problem in dentistry, and it's getting worse. I see many patients for second consultations where I find a fraction of the treatment plan that was presented to them at other offices. And now the model in dentistry is going towards the corporate model. And that is where there's a group of investors that buy up multiple dental offices or open multiple dental offices, and the investors expect to make a profit every year. So that's an added layer in the formula for the dental industry. So if you think about wandering into the wrong office, you've got investors that expect to have a profit every year. You've got employee doctors who are incentivized to find more treatment in every mouth, and the whole staff is then incentivized to find more treatment in every mouth. That's how they produce more, and that's how all 5 layers of the corporate model make more money. If you think about it, it's 5 against 1 in most dental offices, and that's hardly fair. So contrast that with an office like mine. I'm not bragging about myself, I'm just a fair person. So a patient comes in, they meet with me and only me. I come up with many treatment options for each patient, and we decide together which option is best financially, functionally, and aesthetically. That's the way I would want to be treated if I walked in for any elective procedure or any necessary procedure. So I think the way to research those offices is go online and read as many reviews as you can. Try to find the office where the patients are raving about the doctor's level of involvement and his level of compassion and his level of fairness by giving multiple options. I hope that helps. Thank you for listening.